welcome to this Governor's Health event. It's one in a series that we're running, and hopefully we will be running some more in the future. Just a little bit of background as to why. As governors, we are your representatives. You, as the members of the hospital, will be voting for the governors to represent you, and as a result of that, we have set up a communication group, and that communication group is there to make sure that you get access to information that is germane to the hospital, but also to the needs of the local community, i.e. yourselves. And so we're bringing several events to you. This one in particular is, as you can see from your screens, entitled Below the Belt. It's basically part of our men's health program, and there'll be several more coming along in the future. But for the moment, this is the first one, and I think it's an enticing title. I'm sure that it's brought up all sorts of imaginational thoughts from you all. But let me start the event, and not enough rubbish from me. As you can see from your screen, Janine Cullen is a specialist nurse in urology, and I think we're delighted to have Janine with us today. If there's anybody knows this topic, it's her. So let me hand across to Janine, and have a lovely afternoon, everyone. I'm going to be turning my camera and microphone off as far as I can. So we'll see you at the end of the event. Janine.
Thank you. So my name's Janine. I am one of the specialist, well, the only specialist urology nurse practitioner in post at the moment, but there's a lot of nurses that work within the urology team. You'll see my hands go up. I talk with my hands, so hopefully that's not too distracting if it happens. I have worked at Kettering General now for 20 years. I have done multiple roles within my time at Kettering General, so a lot of urology experience because all of my roles have involved urology. I'm going to talk to you today about the below the belt issues. It's got more of a male theme to it, but I did have a couple of questions that were from ladies, and I'll try and address some of those questions as I go along for the waterworks issues that might affect ladies as well. Just a little disclaimer, I'm going to be completely frank, open, and use words and terminology that you might think, oh my goodness, I can't believe we're having to listen to certain bits and pieces like this, but it's because those are the issues that come up. So it's important that we have the chance to have those discussions and at least be a little bit more aware of the waterworks. So my title is Below the Belt, and the first thing that I'm going to talk to you about is how important it is to look after the below the belt issues. It's an embarrassing subject. Everybody would rather ignore the symptoms than go to the doctors and say, oh, I need you to look down there because something's not quite right. But I can't stress enough how important it is. And actually over those 20 years, we've had so many more people more recently with more education, with more access to, screening things and to awareness that are presenting with their symptoms a lot earlier. So I'm really pleased that all of you've joined today, because it may be that you're picking up some of the symptoms that I'm going to mention and that we can get you sorted, because the very important thing is that finding things early and getting them treated and sorted is going to be key to you. You don't want to suffer symptoms. You know, it's bad enough as it is to have an embarrassing symptom, but to leave it is much harder for you. So the main thing is to go ahead, take these bits of information I'm going to share with you, and if you're worrying or if you think you might have some of the symptoms, go and talk to the GP, or there's a lot of other ways you can get some information. So I'll go through those as we go along, but don't be too embarrassed, please. We know this is what we do all day long, every single day, and it's important that you can feel confident we're going to be able to help you, but more important that if there is something that needs sorting, we can do that quicker rather than later. Ultimately, one of the things that people worry about the most is obviously cancer, and there can be some cancers that are to do with the waterworks. So I'm going to talk about those as well, but not everything is related to cancer. The main thing is pick it up quick and we can then move on and give you some treatment for it. So next slide, when it wants to move for me. Here we go. What things should you be checking? Well, to me, it's anything that's different to your norm. Because with the best will in the world, we can show you all the pictures, you can read everything on the internet, and they are going for the majority of the public. What I need from you is anything that's different for you. So lumps, bumps, they might already been there. They may have been there for donkey's years. If it's something that's different for you, that is where we really need you to be thinking, I better go and find somebody to check that this is what is normal, or if it needs any further investigation. A lot of what we tend to pick up is, particularly below the belt, is young chaps. Now, I'm going to be honest with you. You will know all boys, the minute they know things are there, they're going to be checking it out. And those are the important things to say, because whilst they're there, they could be checking out any differences or any problems. But actually, only 3% of the young men in the communities are checking properly and checking on a regular and timed. Well, I'm going to give you some advice on how to do this, but as a regular thing, try and keep it as a, once a month, I'm going to do my proper check, just like ladies would do for them, perhaps their breast checks. It's important for the boys to also consider what's below the belt. So one of the things I'm going to talk to you about is how to do a testicular examination, which is going to be the next slide. And I can't see if you I'm not sure how big that's coming up on your screen, but I'm going to go through things with you. The most important thing to do is to pick a date on the calendar. I don't know, first of the month, whatever suits you. Best thing to do is to do it when you've hopped out of the bath or the shower, because things are much more relaxed, the muscles relaxed, and your testicles will be better in the scrotal sac there. Obviously, it's all clean and tidy then as well. What you're going to do is you'll look at them. You know what is your norm. One of them's generally higher than the other. Pop them into your hand, feel the weight of them. Sometimes one can weigh more than the other in terms of a testicle. So pop them in your hand, have a look, see what the norm is for you. Next, you're going to use your thumb and your forefinger. Now, I don't want you squeezing too tight here because it'll hurt and that'll put you off. Interestingly, majority of our testicular patients who develop a testicular cancer, for instance, it's actually picked up by their partners. So just because you are sitting there as ladies and don't own a pair of testicles doesn't mean that this doesn't apply. If you have a male partner, sometimes that thumb forefinger check is actually picked up by a partner. So for the chaps out there, thumb and forefinger, and you're going to use a fairly firm grip, but not so that your nails are going or your knuckles are going white. That'll be too painful. And in a almost zigzag motion, you're going to check. Now, I have got a pair of testicles that I've owned, not personally, but since I started my nursing. And basically, you're going to be doing a circular and zigzag motion across the entire testicle. So back, front, sides, check the whole thing. There's a few things in there completely normal. One of them is your vas difference, which is the spermatic cord. That feels a little bit like a piece of thick string. That's normal to find in there. There's another bit that's called the epididymis, and again, that feels like a little lump just on the side of the testicle, completely normal. What you're looking for is anything that's not normal for you. It may be that you've got a swelling, and it could be that that's just a fluid-filled sac of fluid around the testicle, and that can be called a hydrocele. Could be you've got a little cyst. Could be, if you've had a vasectomy, that you've got a little bit of backup of the seminal fluid, the sperm backing up in the tube, and that can feel a little bit hard. So there's a few things that might just be normal for you. Anything that you feel and you think, not so sure about that, don't be afraid to do things like moving the skin so that you feel, if you think, that doesn't feel quite right, move the skin, see whether it is showing up a little lump there for you. And if there is something that's not quite right for you, or if you're seeing indentations in the testes, or in the scrotal skin, or if there's any pain, or if there's anything that's not normal for you, please go and get that checked. A lot of what I've said are completely benign conditions. So your swelling in your scrotum might be a hydrocele, that's a collection of fluid. They can get quite big. You might notice after a long day walking, or if you've been on your feet quite a bit, that it swells up that little bit more. And then you put your feet up at night. By the time you've woken up in the morning, that swelling's down a little bit. It fluctuates. So getting a good history of how long things have been not quite right for, or if they become uncomfortable, because we do have some gentlemen whose perhaps hydroceles get a little bit large and they can end up being uncomfortable sitting down. So if that happens for you, pop along to the GPs and they can have a look. They might get a torch out, don't panic.
I mean, I'm not
when they shine through a test a scrotum, if the fluid in there is the problem, it illuminates a little bit like a light bulb. So they'll put their torch on your scrotal skin and then they turn the light on and it glows. If they're worrying about things, or if it's a solid lump that's not quite, you might see that it doesn't glow. I was showing some colleagues earlier, but I don't think it'll come through on the camera quite as good. It's just, if you have got a torch at home and you happen to be a chap with it, then you can shine through and see how it will glow in the tissues will glow up with the light behind it. A bit like when you pop your thumb over a torch end. So those things are important. I'm going to recap again so that you know what to do to be able to check. So you're out of the bath or the shower when things are hanging low and you're comfortable. Thumb, forefinger, and gentle zigzag motions all the way around the testicle. So not just the back and the front, you're going around the sides. You're feeling to see if they weigh more than one or the other. You know which is your high and low side, and if there is any pain or if you've got any concerns about things not being right for you, then 100% please go to the GP and get them to check. For the younger gentlemen out there, there is something called a torsion of the testes, which is where it twists around. So for anybody young out there, if you're getting pain with in your scrotum, don't delay it. Go and get that checked out. It's embarrassing. I know it's embarrassing, but we're very professional and we see this all the time. So it's better to just go for it and get those things checked. Otherwise, you know, we could be able to help you sooner rather than later. Okay. If they find any problems with testicular cancer, it's one of the well-treated cancers, if anything, and generally speaking, it will go to people who are young, fit, healthy, not smokers and non-drinkers. So please be aware, it doesn't mean that just because you're doing the absolute best for yourself that you're not at risk. Please check. Okay, so next little bit of information I'm going to give you is the prostate. So men are born with their prostates, grows roughly to the size of a walnut when you get to the age of puberty, and its job is to make the majority of the seminal fluid that you see when you ejaculate. The position of it is, I always describe it a bit like a donut. So you've got your bladder. I've got a little gadget here. I don't know if you can see this, but I'm going to show you a picture anyway. So the bladder is sitting here. There's a little bit here that shows you your prostate, and then running through the middle of that is your water tube. Now, you go along with that absolutely brilliantly whilst you're in your teenage years and onwards, but about 40, 45 onwards, that prostate can start to grow again. Little pub quiz fact for you that you're going to win now. 3 things on the male body will continue to grow for your whole life. Your nose, your ears, and if you're a boy, your prostate. So it will grow, and then you can start to develop a few waterworks symptoms. Now, the symptoms, whoops, I don't know how clear that is for you to see, but there's your bladder, there's the prostate sitting around the middle, and then you've got the ducts that will bring the sperm in through to the prostate. It'll mix with the seminal fluid. So as we're getting older, it starts to block this channel in the middle here, and it's a bit like squeezing down. So not only does it grow outwards and become bigger, as you can see on the picture, but it will also squeeze down so that your nice water channel when you're younger then becomes a nice tight little one, and the wheeze start to be a problem. Now, with that, you might notice things like getting up at night time. You might notice a little bit of stopping and starting as you're doing your wee. So you sort of think go, and then you think, no, there's a bit more coming and a bit more, and it comes in spurts. You can sometimes find that you've got a bit of a forking of the stream, or a spray, which you might get ticked off for if there's more than one of you at home, because there'll be a damp seat or a damp patch by the side of the toilet. But these are all little things that are showing us that that prostate opening, the urethra, is no longer as wide as it was. It's now pinching down a little bit. You might find that you have difficulty starting to do a wee. So you're in the pub, that whippersnapper's been, gone, finished, and you're still waiting to start. Again, that could be something to show us that the prostate's becoming that little bit larger. You might find that the flow is a bit miserable. So I usually say, are you splashing your boots, hitting the pan of the water, or can you manage to get over the 5-bar gate? And that gives us a good idea about how good the flow is going to be. If you've got difficulties with the flow, there are things that we can do. So bearing in mind, if you do come and see us with any of those symptoms, you will get an examination usually, and it's in your bottom because your prostate is felt through your bottom. And it's what we call a digital rectal examination. So if the finger goes into the back passage and we feel across the prostate at the back there for you, which is embarrassing, I know. Top tip, bend your knees up because we're going to get you on your left side. Bend your knees up towards your tummy, and then that will bring things a little bit lower for us so we can reach things as best we can. 3 things usually go wrong with the prostate as you get a bit older. So we've got, first one, prostatitis, and that's generally with the younger generation, so the 45 onwards. And that might be bit of burning and stinging pain when you're doing your wheeze, but it also gets described by some of my patients as like a dull, toothache feeling, that throbby feeling you've got in the background that is happening actually behind your testicles, but before your back passage. That flat part, that bit is where the prostate is sitting, and you can get that dull, achy feeling that sits there. So if you have got any wee infection symptoms, so that would be smelly, cloudy, stinging wheeze, you would go and get yourself checked out at the doctor's surgery, especially for chaps. It's a lot more difficult for a chap to get a wee infection as opposed to us ladies. However, you'd go and get that checked out, and you may be put onto some antibiotics. Now, with prostatitis, the prostate's a lot like a sponge, and it's a donut sort of shape. That picture will show you, but it goes all the way around, and it's got lots of nooks and crannies. So its job is to have that seminal fluid. It will empty the ejaculatory fluid, and some pockets of it will empty, but not all of it. And there is where the problem lies, because those infection pockets can then take quite a while for us to clear for you. So you might be on antibiotics for anything up to 6 or more weeks to try and get rid of prostatitis. It's one of the ways that we treat that. The next bit could be benign prostatic hyperplasia. We do like sneaking a bit of Latin wordage in. If there is a way to say it and we can put Latin in there, we're probably going to do it, but we shorten that down to BPH, so benign prostatic hyperplasia. And basically, that's a non-cancerous swelling of the prostate gland. A lot of men are going to have this because, as you know now, your nose, your ears and your prostate, they're going to keep growing. So with this benign prostatic hyperplasia, you're still going to experience that difficulty getting started, getting up at night time. You might get some urgency where you've got to go and you've got to go quick. You might find the flow's a bit miserable. You might find that you've got stopping and starting, not emptying completely. So you're back again within a few minutes going, I need another wee. And actually, that's important because if you're starting to get those symptoms, it's indicating that you're not fully emptying the bladder. If you're not fully emptying the bladder, then it's going to sit there and stagnate, and there's risks of getting infection there or even back pressure up towards the kidneys. So emptying the bladder fully is going to be really, really important for you. You might find that you are getting other symptoms. Occasionally we get a bit of blood in the wee. If you do notice a bit of blood in the wee, which goes for a lot of other things, make sure that you do not ignore it. Blood in the pee should not be there, and there'll be a reason for it, so we need to check out what that is. The tiniest little bit of blood in the wee can discolour it, so I would like you to aim for a colour of wee of a cheap white wine, or straw coloured if you're not a drinker. We're going to go for that pale yellow colour. And if we see a little bit of blood in there, it can change that quite quickly. You might see a little bit of rosé if you're a wine drinker, or a bit of, oh gosh, strawberry cordial if you're not. And then if it gets to a problem, you might see a bit of claret urine and clots, which we wouldn't want it to be. So that would be like a strong black currant without any cordial, without any water in it. Anything that you are not certain of or that's not normal for you, please go and get it checked. That's the simplest message. If it's not normal for you, you need to get those things checked. The final thing that can happen with the prostate is prostate cancer, and I've done a lot of work over my career with the prostate cancer patients. It's very treatable these days, and as is the benign condition. So we start off with things like medications, but we can also do surgeries. And for prostate cancer, we've seen such great advances now in the treatments and the availability of options for people who have now been diagnosed. And we are seeing a lot of people come forward now. I'm going to do a little bit of plugging here. Old Kettering General, we've got a one-stop service that we're trying to improve all of the time so that your journey through our system is as quick as possible. I will warn you, you'll have heard of something called a PSA perhaps. It's a prostate specific antigen and it's a blood test that some people have. I'm going to mention it because it's something that people sometimes think is a cancer indicator, and I don't want you to think it's something that is a cancer indicator. It's an indicator that there is pressure on the prostate. It doesn't tell us what it is, and therefore will involve you going for further testing. So when you have a PSA checked, bear in mind the following things. We can get a high result and it not be a problem. We can get a low result and there can be a problem. And if we do check that, we generally also do a digital rectal examination. It may lead on to an MRI scan. It can lead on to a biopsy of the prostate, and onto that would then depend on the results and maybe further treatment in the form of big surgery to remove a cancer, or radiotherapy or chemotherapy, or a whole host of treatments. So it's not quite as simple as one test. That test may be helpful, but it's not on its own. It's in the context of a lot of other screening methods that we use to make sure that we're not missing anything, but equally so that we're not giving you a diagnosis of something that's not correct. So, for example, with the benign condition, you can have a high PSA, but there not being no cancer in there, or you could have a low PSA and still have a cancer present. So it's not a test to be used on its own, and you might find that some of the GPs and our other colleagues are a little bit reluctant. They would go more on a family history perhaps, on your age, because 80% of the male population is likely to have a prostate problem, and even perhaps a prostate cancer in the latter years of their life. And it's oftentimes something that never bothers them, but that obviously we can manage if it's picked up. So a very difficult decision needs to be made, and one where you need to think about whether you want to have a blood test that will then potentially bring you on to further treatments and further management, or whether you're going to be a person who thinks, okay, there's a chance I might have a problem with the prostate. I actually feel well and I don't have any worrying symptoms. I'd like to just continue with a good quality of life as it is. It's a very important decision to make, and you must understand that we're probably going to do further investigations and treatments if we find anything. So just to be aware of that. But have a chat with your GPs if you're concerned that you may have a problem with the waterworks. And one of the things that they'll check is perhaps the PSA with a digital rectal examination. If they find that the PSA is high, they might say, we'll do that again. And the reason for that is because sometimes a wee infection, would you believe, can push the PSA up, as can bike riding or vigorous exercise, ejaculation, anything that presses down on that prostate. So even a stubborn poo going past the prostate can push out a little bit of that PSA for us, so they'll repeat it. You may end up with 2 of those and then a urine test just to make sure there's no infection there. If those do show that the PSA is genuinely high, or that there is a problem, or when they feel the prostate they are suspicious, you're going to come through our service and you may meet myself or some of our colleagues, and we'll go through the various testing processes to make sure that we've got you on the right treatment pathway if you need it. So that's the prostate. Again, there are lots of things that can be as a result of the prostate being a problem, but generally speaking, the majority of people go through this without too many difficulties. So you might find that you think, oh, do you know, I'm supposed to get up at night time, and perhaps you are. If you've had a load to drink before you go to bed, you're going to get up and have a wee. There are some culprits that will make your wheeze a little bit worse. So tea, coffee, alcohol and fizzy drinks, they all contain diuretics, and so they're going to make you wee more than you actually drink. I've just been on holiday and I was lucky enough to have a couple of teas, coffees, alcohols and fizzy drinks. But what I did notice was they always give you a glass of water after as they give you your drink. So I think that's a good thing to be doing. If you're going to steal some of the fluid by this diuretic, try and make sure that you're drinking a bit more water in between each of the drinks so that you can replace what you lose. Now, you're going to aim for that cheap white wine colour of your wee, and I've got a picture of the colours of wee that I'd like you to aim for, but making sure that you're drinking the right kinds of drinks can really help. So you might find some people will say to you, oh, decaffeinated, and decaffeinated is fine, but it does also contain tannin, and tannin can irritate the bladder lining. So the way I describe this one is using the example of like a cup of tea. Sometimes you get the staining around the inside of the mug, and if you imagine that's the tannin, that is the bit that is irritating your bladder lining. So if you're struggling and doing lots and lots of wheeze and you're fed up of getting up at night, then perhaps look at what you're having to drink, because those can be the culprits. And it can be something as simple as avoiding those caffeinated or stimulant drinks before you go to bed that enable you to have a really good night's sleep. Also, you can sometimes notice that you go to bed with a pair of puffy ankles after a very, very busy day, and you wake up, they're slim as anything, but you've been in and out of bed all night long. You're getting rid of those the fluid that is collected in your lower limbs sometimes over the day. So top tip, whilst you're resting in the evening, get your feet up nice and high and see if we can drain some of the fluid that's in the lower limbs up towards the kidneys before you go to bed. And then that way you'll save yourself maybe one, if you're lucky, 2 wheeze through the night. Bearing in mind, don't go drinking a load of coffee and tea before you also go to sleep. So if you're finding that they are affecting you, you'd have your drinks a little bit earlier on in the evenings, get your feet up nice and high, and you may find that helps to get you a good night's sleep. And that's for ladies as well. Feet up nice and high and making sure that you can do your fluid for you a little bit earlier. As we said, the common problems I've gone through are benign swelling, very, very common. Prostatitis, which is the infection one, and will need some antibiotics, and then prostate cancer, which really does need to be discussed with your GP, and whether you are in a position where you would want something to be done, or whether you'd want us to keep an eye on things. Very important to have that first discussion, because once you're on the journey of checking a PSA, there's oftentimes a whole lot of other things that go with it that you need to be prepared for and, you know, aware of. It's not quite as simple as just one blood test. We are, however, looking for screening tools, and unfortunately, unlike the breast mammograms and the cervical screening, there isn't one thing yet for prostate that we can use to tell you yes or no. You'll read in some of the papers, there's urine tests, there's all kinds of other things that they're trying, but we haven't quite reached the point where there's one test that will say yes or no for you. So it's got to be considered. Now, symptoms wise, we've got the, I'll go through those again just to remind you. So any blood in the wee, we need to know about. Getting up at night time, depending on how much fluid you've had. So if you start to notice, I'm getting up a little bit more at night time, look at how much you're drinking before you go to bed and what you're drinking, and see if that can be improved. If it's still a problem for you, you probably do need for us to see one of us. Frequency in the daytime, depending on how much fluid you're drinking, can also be an issue. I'm a big fan of those motivational water bottles, although I'm not a great fan of water myself. I still know I need to drink it. It's good for everything. It's good for your kidneys, it's good for your skin, it's good for your bowels, and keeping hydrated is really important through the day. So try, if you can, to get one of those, even if you get an empty bottle and just use a marker pen and put 9, 10, 11, 12 on one side, and then 1, 2, 3, 4, 5 on the other side. Drink between the gaps, and then you're keeping yourself hydrated. That's quite a good tip as well. If you have any difficulty with urgency, it may be that you have some irritative symptoms and that there could be a wee infection. So you're looking for things like smelly, cloudy, or stinging wheeze. They indicate perhaps that there is a problem with the waterworks and possibly an infection for you. If you've got a stent inside, which we sometimes do, from the kidney down to the bladder, it can give you some of those symptoms as well. So depending on where you are in a journey, if you've just not had any urology issues and you've got those symptoms, we need to check if there's a wee infection there for you. So it's best to go to the GP and for them to check a sample, and then they can say yes or no, or if you're having symptoms, get those checked out. You might, as I say, find that you've got stopping and starting of the flow, and you might have a little bit of hesitancy, which is having a bit of trouble getting started, or a forking or a spraying of the stream as it goes. All of those things are showing that there's some pressure somewhere. Is it because that opening has narrowed down, or is it because there's a bit of a scar tissue and you've perhaps had previous infection? There's lots of reasons why, but we need to figure out what that is. If you came along with any of those symptoms, we might say to you, we'll do a camera test, which is done through the end of the penis, or if you're for a lady, it goes in through the water hole near your vaginal area. And then we'd be able to see inside, see what's going on. You might find that you also start doing a little dribble. Now, there's a top tip for this one, for the gentleman at least, and sometimes for the ladies. What you're going to do for the gentleman is you've got a U-bend in that water channel. I don't know if you can see it again on my little picture, but you'll see it on my little gadget. You've got the bladder, prostate, and then it goes in a U and then out. So that U-bend traps a few dribbles in it. And what you do is just behind the testicles, before the back passage, that's where that U-bend is starting. Do a gentle press upwards and then push, and you'll get those tiny little dribbles out. The other thing is, if you own a foreskin, please retract that, because that will stop sometimes the spraying or the forking of the stream. But always remember, put the foreskin back over, because that can cause a big problem for you as well. So you might find you get the little dribbles. Occasionally you can have what we describe as incontinence, so where the control isn't going so well, or you can have retention of urine, which is where you've been hanging on to those wees for so long, it stops being uncomfortable, and you get a chronic situation where you're not able to pass all of the wee out of the bladder, and definitely that would need to be seen by us, so that we can then bypass that narrowing of the prostate, pop a tube in and help you empty the bladder for you. And then there's different types of treatment that would happen from there. But making sure, again, if it's not right for you, get it checked. You might find also that you've got a bit of pain in your testicle area, or if you've got any pain when you're passing your urine, sometimes a little pain on ejaculation, and occasionally we can see people who've got a bit of blood in their semen as well. But it depends entirely on what the symptoms are. And again, if there's blood there, that's not normal, and we need to check it out. We need to figure out what's causing it. So most importantly is go to get someone to find out what's going on for you. Some men might not have a single problem with their prostates, no single problem with their waterworks. However, they have a family history, or they're an at-risk group, which the Afro-Caribbean community are considered to be at more high risk of prostate cancer, for instance, and they will get their PSAs checked, or they may be doing a well-manned screening session for you where they've asked you if you want to get it checked. And sometimes it can show us that there is a problem where you didn't even realise you had one. So don't think that you have to have all of the symptoms that I've mentioned to you to have a prostate problem. It's one of those things to be aware of. And then if you are in an at-risk group, which are those who are obviously of Afro-Caribbean descent, and if you're getting a little bit older, or that you have a strong family history of it, then you might want to be having the PSA checked. And those are the criteria usually that would get you a check without any symptoms. So moving along, if I can manage to, second time lucky again. I can't reiterate it enough. You've got to check things that aren't quite right for you. See your GP, have a chat with them. They may reassure you and say absolutely fine, and they will probably do a digital rectal examination. And if they're not sure, if they think they've got something that requires a further intervention, they're going to follow you on with a referral over to us, and then we'll investigate as required. So these are the colours of urine. Now, I will confess that one of my delightful junior doctors recently bought me a poster. It wasn't one like this. It was actually glasses of wine, and we worked through the colours of the urine with glasses of wine. But I am going to show you the non-wine version here. So we've got the light yellow. That's normal. You're hydrated. I could tell you to drink 2 to 3 litres of water a day. It's quite hard to, you feel a little bit full sometimes of water. So the best top tip is to peep inside the toilet. Hopefully you haven't got one of those loo blues and you're worried about green weed, because that will, obviously if it's yellow, it's going to change the colour for you. You're going to go for a pale yellow, a light yellow, nicely hydrated. If it gets any darker, which generally is in the morning, because you've been not drinking overnight, you're going to drink some more fluid, and as you're drinking, you're going to see that the urine becomes a lighter yellow. So yellow can be fine as well. It's a little bit more concentrated when it goes darker. Amber, your body is dehydrated, and therefore you need to be keeping your fluid up. So remember, tea and coffee, alcohol and fizzy drinks are just going to steal a bit of the fluid from you. So you can think, oh, well, I'm hydrated, I've had a cup of tea. It's going to, if it's a caffeinated drink, you're going to take a bit of the fluid away from your body, and you need to replace that with a glass of water. And so promise yourself you'll enjoy your cup of tea, but you'll have a glass of water afterwards to replace what you lose. If we're going brown, we're again still dehydrated. You can sometimes see quite dark urine, as I said, in the morning, but over the day you should start to see it becoming a lot lighter. And obviously red, we might have a kidney infection, we might have a cyst, we could have a kidney problem with a cancer, we could have a kidney stone. So we've got to work out what that actually is, and oftentimes we'll bring you to the hospital, camera test to peep inside the bladder, and a scan to work out where that blood was coming from. We're going to aim for, as I say, 2 to 3 litres a day is the one of the suggested ones. I'm a fan of look at the colour. As long as it's a pale yellow, that you're doing great. What I don't want you to do is get it clear. If you get your urine completely clear, you have just washed all the good salts out of your system, and we don't want that to happen. So get it pale yellow, but don't go overboard and clear out all of the good salts. If it goes completely clear, you're counteracting what we're trying to achieve with making sure that you're hydrated. So again, a little recap of that. Plenty of fluid. Try hydration bottles. They motivate you because you look and think, oh heck, I haven't had anything to drink from 9 to 10, and you'll get that little bit of extra fluid in there. If there's blood, then we need to figure out why that's there. Now, you'll sometimes go to the doctors and the wee will look clear and they'll say, oh, we've got microscopic blood in there. That can be from infections, can be from little stones. There's criteria that the doctor's got to refer you over to us. It's based on age occasionally, but also if there's a history of stones, and smoking can be an issue with the blood in the urine sometimes. So I will just mention that now because I've mentioned it. Oftentimes people don't realise that breathing in cigarette smoke, or even I believe the vaping systems as well, you're breathing chemicals in, and one of the jobs of the kidneys is to clear the blood off, make it nice clear before it sends it around your system. So as that happens, all of the rubbish that you've cleaned out the blood in the kidney system is going to then be converted, and the waste product is your wee. It trickles itself down to the bladder, and of course we're not going to the loo all of the time, so that then will sit in your bladder for 2 to 4 hours, and that we can sometimes see cause bladder cancers, or if there's a strong history of smoking, we can see kidney cancers as well sometimes. So bear in mind, smoking, if you are a smoker, is probably best to start thinking about stopping that as soon as possible, because it's one of the risk factors. Equally so, chemical dyes. So perhaps photography, if you're doing photography, making sure that you are having the right breathing apparatus to prevent you inhaling some of the chemicals. Also, those who work in the chemical dye industries, we have a lot of boot and shoe trade, well, for this particular area, and the chemical tanning dyes can be an issue. If you're dealing with anything that's got a chemical in it, you want to make sure that you're protecting your airways and making sure that we're not getting too much of the rubbish breathed in, which is tricky given that a lot of environmental factors are involved, but making sure that you're drinking plenty as well will stimulate you to do those few more wees, and then we can avoid those things sitting in your bladder for too long. Stones, are, generally speaking, from those who haven't got the best fluid intake. We see a lot of truck drivers or people who do jobs where it's not easy to have a drink or get for a wee, so they tend to be stone formers. Keeping your fluid up is very important, because we've got a phrase we use. It's called once a stone former, always a stone former. Once you've had one, the likelihood is you'll have more. And if I'm honest with you, they are extremely painful. You do not want to have a kidney stone, which has to pass from the kidney down into the bladder. It's very, very painful. Another reason why you should be drinking plenty of water, because you'll be able to filter things through and avoid any crystallization and stones from forming. Also, diets high in red meat are not always great. There's other factors that we would mention to you if you were a stone former, but the hydration bit is the most important bit. So, moving on, blood in the pee. So we were talking a moment ago about what happens when there's blood in the pee. A lot of that time we have got campaigns that we run for blood in the pee. You might have seen stuff on the news or on posters and that sort of stuff. Never ignore it, even if it's a one-off. As I've said all the way through, we're not expecting to see blood in places, so we've got to make sure we're acting on what we're seeing. It could be a stone, not the rolling kind, but you've got to make sure that if that is the case, that we are looking to make sure it's not blocking the drainage of the kidney, so that you're not getting any problems of damaging the kidney from that. Infections, we can see infections causing blood in the pee, as well as sexually transmitted diseases, and sometimes you can see hygiene issues causing a bit of blood in the pee as well. So obviously we've got to make sure that everything on that front is observed. In fact, I've got a couple of top tips coming up for you in the next couple of slides for trying to avoid things like water infections, etc. The prostate obviously has got a really good blood supply, and because of the job of it making the seminal fluid, and because of that we can have some weak vessels in there and they can pop. So you might find that those little vessels pop, you see a bit of blood in the wee, you drink plenty and it stops. And then because it's inside and it's a wet area, you might then find that you have a clot that forms, rather than it being on the outside and a scab forming, you'd have a clot forming. If you do anything that strains your tummy muscles, it may pop that clot off and you'll see more bleeding. And then it's a bit of a vicious circle, because if you pop them off, they're going to bleed again, so you drink more. What you're trying to do is avoid any straining of the tummy if you see blood in the wee, until we get to see you for what you're doing. Make sure the bowels are good, because as I mentioned before, the pressure sometimes is higher in the bowels than it is in the bladder. So straining past the emotion, you might squeeze your tummy muscles, it pings a little clot off. You can sometimes see blood in the wee after that. And making sure that you're not doing too much heavy lifting. And we sometimes see people who do lots and lots of walking can see a bit of blood in their wee as well, because those little vessels are popped or rupture a little bit and give you a bit of blood in the wee. The other thing that can cause blood in the wee, as I mentioned, is kidney cancers and bladder cancers. So it's important to check that those things aren't an issue for you. But generally speaking, it's more things like the infection sometimes, and making sure that you're not ignoring any symptoms. There's lots of reasons that you could get these things, but don't ignore them. So the next thing, how we can avoid things like a urine infection returning, because oftentimes with the wee systems, especially with the ladies, we've got a shorter wee tract than you chaps have. So for a lady's perspective, you're going to be wiping from the front to the back, so that you're not contaminating any of the cells that would be passed in a motion down to the front and causing any infection. Keeping the genital area clean and dry, that's men and women. Drinking plenty of fluids. As you know, we're a great fan of water, so that you're peeing regularly and in the daytime and you don't feel any thirst. If you've got excessive thirst, making sure that you're checking for other things like diabetes as well. There's other reasons why you might be particularly thirsty. You're going to wash the skin around the vagina with water before and after sex is an option. Most importantly, if you're a lady, you're going to wee after you've had sex, because the contamination, and because we've got a little short wee channel, it can be quite easy to get repeated infections. So making sure that you do a wee after sex can help with that. And then if you're incontinent, making sure that you are changing pads or if they become soiled, because obviously it's a risk of contamination. And what not to do. So things that might contribute to you having a bit of a wee infection. Try and avoid things like scented soaps. They smell lovely, but they're not always good for our waterworks channels. Try not to hang on to a wee too long if you have the if you feel the urge to go. That wee needs to come out. We don't want it backing up and causing a bit of a pressure for you, or stagnating and giving you a wee infection. Try not to rush. We're always in such a rush to get in, get out, go. Take your time. A lot of our patients that we see, especially the chaps, they go, ooh, I'll say, do you stand or sit to have a wee? And they'll look at me as if to say, sit? I don't sit. Well, do you know what? It's actually fine. If you can have a seat, take your time and make sure that you've got a chance to empty your bladder fully. You're going to have less risk of getting infections. Another top tip is to kind of lean forward a little bit, or I say do a little hula, is move around just to make sure that you're emptying the bladder as much as you can, or just leaning forward. And sometimes the tummy contents pressing down on the bladder can get that last little dribble out, or it also straightens out that U-bend in the water channel. Try not to wear underwear that's too tight, or that's not man-made. We want to go for cotton type briefs if you can, or underwear if you can. If you can't, then make sure they're not too tight. Try not to drink lots of alcoholic drinks, as they may irritate your bladder. As I mentioned again, tea, coffee, alcohol and fizzy drinks, they're going to make you wee more than you actually drink. Try not to have a lot of sugary food or drinks. They will encourage bacteria to grow. And try not to use a condom or diaphragm with spermicidal lube on them. Try non-spermicidal lubrication or a different type of contraception if you're finding that you're getting wee infections. Those are quite helpful. Otherwise, if you are finding, because one of the questions that was put to me prior to this talk today was repeated antibiotics, having antibiotics on a long-term basis, and sometimes we have to do that. We call that prophylaxis. But it can be something that you have to have for a long period of time. And generally speaking, we give you a low dose of antibiotics once a night. It can upset your tummy sometimes. And I know one of the questions was, how do we get around that? Well, occasionally we suggest using probiotics, because antibiotics are killing a lot of bugs, but you want some of the good ones back into your system. So occasionally a probiotic just to put the good bacteria back into your system can be helpful. But also if you're suffering from cystitis or some of the other symptoms of things like interstitial cystitis or other bladder conditions that we can see, it can be really difficult to have a good quality of life. You're weeing constantly and it just feels like you're never quite finished and then you're back again. So there's a couple of options there. D-mannose is a sugar that you can buy in a tablet or a powder form, and you take that every day. But like everything, that will help to prevent certain types of bacteria from sticking to the walls of your urinary tract and causing infection. However, I'm going to use a random example, tomato sauce. You can buy tomato sauce, but if you actually look at how much sugar and salt there are in those things, you'd be quite surprised. So equally so with these things, check how much salt and sugar are in these things, because I don't want you having a problem with your blood sugars or with your salt levels because you've bought one that's quite high in those levels. Cranberry products, especially for ladies, we often tell ladies to drink plenty of cranberry juice. They come in capsule form as well and tablet forms, and the concentration you get in those is much higher. So it's great that you drink cranberry juice if you do. It can be quite expensive though, so I wouldn't say to you, if you don't normally drink a juice, don't sort of spend a fortune on these things. Water's a good thing, but cranberry products can be helpful. And speak to your doctor before you use any of those sorts of things, just to make sure it's not going to interact with anything, because particularly warfarin patients, there's a lot of things you're restricted on, and it's better to make sure that you aren't using any of the treatments that wouldn't work well with some of your other medicines. So definitely check that. From a prostate, as we're on fluids as well, from prostate side of things, those with prostate cancer who have seen us, you'll see that we oftentimes recommend tomato juice. or tomato products, particularly the processed varieties, because it contains lycopene, and lycopene works on the prostate cancer. Unlike red wine, we'll go for red wine because that's one of the things, or wine in general. People will go, you can have a glass of red wine, that's good for you. And then tomorrow you'll read the paper and it'll say, don't drink wine. So what I would say is tomatoes have been around for donkey's years. They do contain lycopenes and they work well on those things. You might find also antioxidants and that sort of thing. Anything with a red type skin is quite good for you. For the prostate side of things as well, just like with the bladder, we're trying to avoid diets high in red meat. Also, making sure that if you like it, which not everybody does, I'm not selling it very well, but green tea, it's an acquired taste, and if you can manage that, that's quite hydrating as well for you. And then again, making sure that you're checking that it's not going to interact with any of the other medicines that you take. So we're on to the penis next. And the penis is obviously not for the ladies to look at, but well, to be concerned too much about, but they also do pick up some of the cancers that we see. So important that you're aware of them at least. We have bendy ones that are a bit floppy, ones that are not, that have been buried inside. And one of the questions I had was, unfortunately, for some of the medications that we give for things like prostate cancer, it will make the testes shrink, and as everything's connected, it makes the prostate shrink, and that may bring the penile tissue inwards, which makes things like keeping clean and dry quite tricky. One of the questions was that somebody had a hernia as well, and that can make keeping clean, dry and comfortable quite difficult because the hernias sometimes slip into the testicular sac. So accessing the penile tissue is important. If you've got something that's causing an issue with that, like a hernia, for instance, you'd get the GP to perhaps refer you for some intervention for that, so that we could at least allow a bit more of room for the penis to be able to be on the outside of the body. We've got lots of treatments for the penile problems. If the foreskin is too tight, we could do a circumcision. Very, very important is hygiene in this area, because underneath the foreskin is smegma. We also know from research that we can pick up the HPV in the foreskin area. So if it's not clean, you'll find that you're potentially going to have problems in that area. So again, non-fragranced soaps and waters, making sure everything's clean. And if you have got your foreskin still, it is essential that you make sure it's always covering the tip of the penis, because if it goes backwards and becomes too tight, it can be extremely painful, and you're going to come and see us in the emergency department for us to be able to put that back for you. If you've got any smells or discharge that's not normal for you, you want to make sure that you are going to get somebody to check that for you. Penile cancers, particularly in this area, for out of particularly Kettering area, so that's, we cover Kettering, Corby, Rushden and Wellingborough. We have about 5 per year of penile cancer, so it's not something that's huge numbers, but it's something that happens, and it's probably in the most embarrassing area for people. So please, if something is not right for you, get us to have a look and see whether we can make sure that we're giving you the right treatments for it. And if your foreskin is becoming too tight for you to retract, again, please come and get us to help with that, because we need you to keep everything clean under there so that things don't become infected, or if there's problems under there that you can't see them. So for patients who have radical prostatectomies for their prostates, again, the penis will go inwards because we can't pull the kidneys down to fill the gap that's made from where the prostate was. And we will see you in things like andrology clinics. So for erections, for penile tissue that's not that is bending, for instance, like a Peyronie's, we call that, you might be seen in one of our clinics for advice on how to treat that, or they may give you the equipment available for erections. We call them vacuum tumescence devices, and you'll have heard of the medication options, which are things like Viagra. There's also Cialis, there's Levitra. There's 101 products out on the market. It's just having the bravery to say, I need some help with that, and then we can happily do that. So don't suffer in silence. There's so much is available for you if you can just find the courage to say, I need a bit of help with that. and we will be very professional with you, and obviously we see this quite a lot, so we're happy to help if we can get you the right treatments so that you get that quality of life back for you. That is majority of what I can talk. I can answer any questions, so if you've got questions, please do, but do remember, keep your eye on the, for this sake of this, is eye on the ball for the ladies. Please, if there's things that are worrying you, don't sit in silence. Be brave enough to speak up if you need any help. Any questions?
Thank you, Janine. I don't know about the rest of the audience here, but I found that a really enlightening talk, and I'm sitting here slightly uncomfortable for obvious reasons, but I'm sure that'll wear off.